We'll shift now to Tim to talk about the experience of his members from UFCW. Tim first became a member of the United Food and Commercial Workers Union in 1998 as a third-generation industrial food worker at a canning plant in Exeter, Ontario. Tim became a staff union representative with UFCW Locals 175 and 633 in 2003, and has served as the local union's engagement and media relations strategist for the last 5 years. He also represents UFCW as a vice president on the executive board of the Ontario Federation of Labour and as a board member of the Ontario Health Coalition. So welcome, Tim. Thank you for coming and for sharing some information about the impact of the pandemic on your members.
Well, thank you for having me, Valerie. Very much appreciate the opportunity to come and speak about the work that our members do at UFCW and some of the experiences they've had throughout the pandemic and what's needed now. Thank you for the work that you do at OCal, and I want to thank the previous speakers for their insights and all the work they do too. And I think many of the things you'll hear me say were touched on, and all of them in particular. I have the great pleasure of being able to work with Natalie Mera on a regular basis as one of the board members. And don't tell her, but I'm missing the long-term care committee this afternoon so I can speak to you all. So hopefully she forgives me for that. I think what I'm going to do to start with is just give you an overview of who UFCW is as a union, because we're one of the largest private sector unions in North America, and often we get feedback that people have never heard of us. So we are the United Food and Commercial Workers Union. We are an international union that exists in the United States and Canada. We have over 250,000 members in Canada, and in the province of Ontario, about 130,000 members, which get broken up into local unions. I'm going to be talking to you about the experience of my local union specifically, Locals 175 and 633 of the UFCW. We represent over 70,000 members all across the entire province of Ontario, and they work in every workplace sector you can possibly imagine. And that includes industrial, both in terms of manufacturing and industrial food manufacturing, retail from grocery stores to pharmacies, healthcare units from long-term care to retirement homes and home care as well, and hotels and hospitalities, first responders. We really do represent basically all elements of working life in the province of Ontario. And so I have had a great amount of experience dealing with this. As you can imagine, the vast majority of our membership have been working on the front lines of this pandemic all the way through, and will be continuing to do so all the way, as their work not only is essential, but almost never can be done from home. It's hard to operate a meat plant from your house. It's hard to sell groceries from your house. So our members really are, in our view, absolutely essential frontline heroes who have been unsung for many years, and it is my great hope and our union's hope that now through this, that a bit of a light has been shone on the work, particularly of retail and industrial workers, for the absolute essential role that they play in terms of keeping us fed and healthy through this. As Natalie outlined, I think very well, long-term care is something that has been ignored for a long time. I have been dealing with healthcare workplaces as a representative for the 17 years I've been with the union as a full-time staffer, and we've been talking about working short and lack of proper funding and the needs in that industry ever since I've been around. And I know my colleagues and other advocates who've been dealing with healthcare settings would tell you that that was happening long before I came around. And unfortunately, what's happened is we've had to have a pandemic where people have died for people to really see this in a more broad sense. And despite that, we don't still see much effort being made on the part of our government in Ontario to provide much change in that industry. I also want to highlight that one of the things that we've seen is that retirement homes often get left out of that conversation. Retirement homes in this province are almost entirely private entities, but are providing service that's very comparable to long-term care homes. Every home that we represent in Local 175 in Ontario is covered under the interest arbitration system, meaning that they've been recognized as providing such a high level of health care that they don't have the right to strike. They instead have an arbitration process, but we see that they have been left out of the conversation pretty consistently when it comes to what's going on, and they're having a lot of the same bad outcomes as other elder care systems like long-term care and retirement, and certainly part of the work that we're going to try to do as a union is to highlight the needs of the entire elder care industry in Ontario and work with our partners, the other unions, public health groups, the OFL, etc., to try to really draw attention to that. I'm going to mostly talk to you about what's going on in grocery stores and in factories, as I don't think there has really been much exposure to that in the media. In recent days, we have started to see more of that coming forward, but it's really been something that, from our perspective, hasn't really gotten as much focus as it should have. And again, we have seen in other jurisdictions that have had very severe lockdowns that it's those kinds of settings that almost never get shut down, particularly food retail. You know, we all need to eat. And so it is very likely that as we continue to move forward, that our members who are working and other workers in those industries are going to have to continue to go to work to do the jobs that they need to do to keep us all fed. And so we would like to certainly draw attention to them. Before I move to that, I'd also like to talk to you very briefly about the needs of migrant farm workers in this province. My colleagues at Ufcw Canada have spent a considerable amount of time over the years trying to draw attention to the very poor conditions, frankly, that exist for migrant farm workers all throughout Canada and in Ontario. There's the Agricultural Workers Alliance that I recommend everybody take a look at. And this has been one of those areas that have had some very significant bad outcomes through the COVID pandemic that got a little bit of attention, but not as much as really those people deserve. And it may surprise people to hear, too, that in the province of Ontario, even not migrant farm workers, but domestic farm workers don't have the right to unionize, which is a great shame. This is something that we very briefly had in the 90s under the NDP government, and then almost immediately was taken away by the progressive conservative government when they came in 95. And still to this day, farm workers and agricultural workers don't have the right to unionize, which severely limits their access to workplace representation and health and safety. Getting into our experience with grocery stores and in the industrial units, at the beginning of the pandemic, there was a lot of confusion about what needed to happen for folks and what safety protocols should be put in place. And as Mario outlined, we were strong believers in the idea of having a precautionary principle applied, that you should do more and not less. You should take every precaution, not less precautions. And this was initially a struggle that we had in the retail settings in particular around whether masking was required, whether safety shields were sufficient, whether customer counts and physical distancing should be applied. And this has really been an evolving situation over the past year and a bit of trying to get there. And one of our significant frustrations that we've had as a union is even when there has been pretty broad adoption of what needs to happen in these settings to keep not only the workers safe, but the public as well, things like safety shields, plexiglass, physical distancing, limiting customers and these things, the enforcement angle on that has been really limited, quite badly so. So, you can make rules, and that's fine, but if people don't follow them and there's no consequence for it, that becomes a significant problem, and that's something that we continue to grapple with to this day. The provincial government, in our view, really failed on this angle as well, where they really hesitated to put out any kind of guidance around masking for a considerable period of time. They left it up to municipal governments to do it, and in the province of Ontario, there are 444 municipal governments. They left that up to them to have bylaw officers policing, whether or not they had bylaws around masking or physical distancing. And it took a long time to get to the point where the government finally provided some guidance around that. But even so, to this day, if you go into your average grocery store, which are now supposed to be limited to a significantly reduced number, you're talking 25% of the fire code. That's quite a lot of people that could be inside a grocery store. And if everybody's on the front end of a till, you're still having a mass of people, not only, again, around the workers, but around each other, which isn't great. And this is something that we continue to advocate to the government for. We certainly have highlighted to our members that they have the right to refuse unsafe work. We've seen some very unfortunate incidents also in the retail setting where some aspects of the public have been very unfortunate, where they leave behind their PPE for our members to pick up and dispose of, which isn't very safe for them. And even worse than that, we've seen some really bad incidents where people get into physical altercations if there has been physical distancing that has been applied, if customers are talked to, there have been some physical encounters. And in grocery retail in particular, our membership is quite young. A significant amount of them are under 30, substantially so, and we've had numerous reports of, some of our members who are barely out of their teenage years getting into altercations with older people who should know better, frankly, and who should do that. And this has continued again to this day. Unfortunately, retail and especially grocery retail seems to be a target of certain aspects of the public who don't like lockdowns and don't like conditions. And so we have seen where there have been anti-masking rallies and these things, that grocery stores become a target for groups to go in to try to see if they can get thrown out, or to try to cause a problem, or to get views on their YouTube channel. And that's been a significant problem. I mean, certainly our messaging has been to the public that we appreciate all the support that they give to our members, that it's not only in our members' interest that they do that, but it's in their interest too, and that these kinds of actions are kind of reprehensible and wrong and should be followed up with as much as possible. Talking about our experience in industrial units. So, industrial units, in a lot of ways, have a lot of the same problems that you see in long-term care and retirement homes and other congregate care settings. You have a lot of people who work very closely together. And so we have worked with the employers to put in a significant amount of features into these facilities to try to keep workers as safe as possible. And that has been limits on carpooling, that has been daily screening, that is staggered breaks and entry, that is social distancing measures placed in common areas like lunchrooms and coat rooms, areas like that. It's added cleaning, it's added PPE. So there have been significant efforts made by the union and by the employers to try to put measures in place to keep people safe. But we are still seeing outbreaks happen. We most recently had one happen at a facility we represent in London. A Cargill plant has had an outbreak resulting in a 2-week shutdown there in order to deep clean, give people a chance to go through, a chance to deal with any infections that they have. Fortunately, to our understanding at this point, none of our members there have had to require severe medical attention, and we certainly hope that continues to be the case. But we had at the beginning of the year a similar outbreak at another Cargill facility in Guelph that also resulted in a plant closure. We've had one happen in Maple Lodge Farms in Brampton. We've had one happen at a place called Belmont Meat. And really what's happening is, whenever you get large groups of people together, the risk factor goes significantly up. We see that anywhere that happens. It happens in jails, it happens in healthcare settings, it's happening in industrial settings. And we continue to try to do what we can to advocate to provide as much safety as possible. What that looks like today is not only dealing with the issues of all the workplace PPE and making sure that people have access, but it's also trying to work with public health units and the provincial government and the federal government around access to testing and access to vaccines for these workers. Again, healthcare settings, quite rightly, were prioritized for vaccine access, and residents were prioritized for vaccine access, but we're only just starting to see that happen now in food. And we all need to eat. I don't know how much more essential you can find than a food workplace for our society to continue to operate. And we're still struggling with this. We're only just now seeing that the government is beginning to work with employers and with us around providing workplace vaccination clinics, because we want to see access to vaccines as easy as possible and with as least hardships as possible for our members to access. That was a substantial problem in healthcare, especially in the beginning for workers in hospitals and long-term care, was access to the vaccines, even when they were offered, was very limited, and people were having to travel on their own time. And that caused some what they call hesitancy, but really it was issues of access that were doing that. And we don't want to see that happen for any other worker who could get prioritized for access on this. These clinics that are showing up in these workplaces are almost entirely being funded by the employers themselves through private agencies. While we, again, want priority access for people, we also want it to be in a way that makes sense, that doesn't violate anybody's privacy or any of their rights. And so we're continuing to work with the employer groups and the government around these to make sure that it isn't just a rush to do these things at any cost, that they're done right and appropriately, and as safely as possible for people. Again, our frustration with this is we've been talking about this since the vaccines first became available, and it seems like a bit of the attitude is, oh, well, we just thought of it now that we should start doing this. And that's been frustrating for us as a union. So, what do we want to see for people when we move forward, and what are our concerns for our members as we move forward through this pandemic? Well, we continue, as I say, to advocate for priority access to a vaccine for all those who want it, as well as testing, because we know asymptomatic carrying is happening, and it's happening in workplaces. So we want to see that happen with as few barriers as possible and as safely as possible, and maintaining people's rights to their privacy and other matters as possible. We are very focused on the physical health and safety of our members and making sure that they have PPE and that their workplace can be as safe as possible. But our focus on their health and safety extends out not only to their physical health, but also their mental health as well. We know that this pandemic has been taking a toll on people. In retail, some of those negative incidents I talked about weigh on people. The weighing of, is today the day I'm going to get sick and maybe bring it home to my family, weighs on people. And we know that our members are having, troubles with their mental health. And we're trying to make as many resources as we can available to them. We're certainly advocating also through the WSIB that workplace compensation should be opened up more so for essential frontline workers to cover mental health aspects. And that is going to be something that we're going to continue to advocate. And we're also very focused on people's economic health as well, because this is a reality that a lot of people in our society who are working paycheck to paycheck, and they have to make very difficult decisions about whether or not they can afford to stay home or if they have to go to work feeling sick, which in a pandemic seems like an obvious thing that we need to deal with that and that workers need supports. So we're continuing the call for paid sick days, although we understand that the premier has seen the light a little bit. He says, we didn't see any details whatsoever from him about what that system looks like. And our expectation is that it will probably be some kind of top up for the federal system, the CSRB, which again provides all kinds of barriers for workers. Not everybody is applicable for it. It doesn't cover people's full wages. There's a wait period in order to get that money. And so we know that there's a hesitancy for people to make use of that because people can't afford to wait for those things. They need supports and they need them now. And for a similar reason, we continue to advocate for pandemic pay. In many of our workplace settings, we had seen and were successful at working with employers to get a system of emergency pandemic pay, a little pay bump applied to them to recognize the difficult and hard work that they were doing in settings and to give them some additional resources to do things like childcare and to buy some more food and to do those things to keep their families going. We really believe that that was an absolute necessity for them. And unfortunately, almost every employer stopped those programs in the fall of last year. We've continued to advocate to them directly that they should continue to do them. And we've also begun to work with trying to focus on this with the provincial government as well to say, listen, there's a moral imperative that goes into these things. Workers need supports, and this is one of them. We already regulate for employers that they have to pay more for people when certain conditions are met, like if they work over 44 hours a week, if they work on a public holiday. There's an understanding that that's a hardship for people and that they should be compensated for that. Well, also working in a pandemic where you could get severely sick and make your family sick should also be one of those conditions in which there's an understanding that people need that extra support and recognition. And so we continue to advocate for those things. We're approaching the day of mourning as it's coming, and we would certainly want everybody to participate in all of the services as they're happening in a modified fashion this year. Unfortunately, again, as Natalie outlined, the access to information about how people have gotten sick has been difficult, and it's been difficult for us to draw, but we know well over 2,000 of our members in the province have been given COVID positive results, and sadly, we've had 5 members pass away from COVID-related reasons. At least 3 of them were almost certain were from the workplace directly. So, our members are working very diligently. They're in the community servicing everybody. We are very proud of the work that they do and are proud to represent them, and we're going to focus as hard as we can to make sure that they get the supports that they need. And we'd ask everybody to consider doing that too and offer supports to all of those workers I listed. And the next time you're shopping in a grocery store, a little thank you goes a real long way for these folks because they're quite weary. They've been working hard. They have gotten very little recognitions over the years, and these people need help. So again, you can find us at ufcw.ca. You can find Local 175 at myunion.ca. I see my colleague Sarah has been posting things in the chat as well for people to take a look at. So please consider these things, and we're going to do our utmost to try to keep our members and other workers as safe and as protected and as supported as possible as we all move through this pandemic. Thank you.
Thanks a lot, Tim, for reminding us of how big an involvement in all of our lives your members have in producing the food and in selling in retail, but in so many other workplaces that of which people are mostly unaware, probably. Thank you for that, and I'm sorry about the loss of your members as well. And yeah, not really words to say about that, except it should never have happened, and especially not work related at all. So I appreciate your efforts to fight for the living again, and the advocacy efforts.